Thank you, Becky and Bill. As Becky mentioned, I am 2 weeks into a new position, but thank you for having me here. We are delighted to be part of this panel, and I wanted to take just a couple minutes to introduce you to a fairly new campaign, the Health Means Business campaign, which is led by the U.S. Chamber of Commerce Foundation, the Robert Wood Johnson Foundation, and local and regional chambers across the country, with the ultimate goal of engaging the business community in the wellness of our nation's communities. So we have two overarching goals for the campaign. The first is to educate the business community on the feedback loop between health and economic growth. And the second is simply to inspire businesses to invest in their communities and really focus on the community level. So the anchor of the campaign so far has been our forums. We're doing forums in 9 cities. We've just completed 7, and I was fortunate enough to actually participate in our most recent forum in Atlanta on my 3rd day. The opportunity in the room at these forums is really to bring together the business community and the nonprofit community so that actual partnerships and relationships are formed in the room. With the unique positioning as the foundation of the Chamber of Commerce, we represent more than 3 million businesses of all sizes. And by working with the local and state chambers, we're able to foster unique relationships, peer-to-peer synergies, create new relationships, and really allow the chambers to serve as a hub for health and wellness in these communities and provide opportunities for businesses to turn to them and for technical assistance. So our next 2 forums are in LA and Chicago, and then following the forums, we'll be collecting all of the feedback and sharing all that information. So right now we see the campaign with 3 overarching themes: creating the movement, building momentum, and accelerating the movement. And in terms of creating the movement, we're really starting with building the case for why businesses should care about investing in their community and community-wide health. And the 3 areas that have sort of raised to the surface when talking with the communities on why they care, particularly businesses outside of the food and beverage industry, are when we really link that worker productivity and that number together. And as many of you know, more than $220 billion per year are lost in worker productivity. And when folks in the room hear this, that's sort of when their ears and eyes perk up. Many businesses have not invested in their employees' well-being simply because they don't understand the cost of unhealthy workers either taking sick leave or being unproductive at work. And I know that Debbie mentioned this a little bit earlier in her childcare presentation. And then, you know, we've heard from a lot of folks that leading companies want to be companies of choice, and they want to be in communities of choice, which tend to prioritize health. And we've sort of created this sentiment of when people are healthier, they're wealthier, and when they're wealthier, they're healthier. And we've also talked a bit about, you know, what are the barriers for these businesses to engage? And the first is simply figuring out that they actually have a role to play. A lot immediately think that if they're not a healthcare company or they're not a health insurance company, that they don't have a role in this work. Once they recognize that there is a role, it's sort of what is that action and what can I do next? And so, you know, we help them create public-private partnerships. We're working with the local chambers to establish wellness councils, and businesses really want and need their support. And then sort of the building momentum is about creating champions. And we do this both through an awards program. We've heard from folks that businesses want to be recognized. They want to be recognized, they want their story to be told, and we want them to actually make a valuable and impactful commitment to this work. So we collect nominations. We'll be celebrating these in February at a big summit. And then we also ask that folks take a wellness pledge. And, you know, and when I first joined the team and I heard about the wellness pledge, I immediately thought, everyone does a wellness pledge. And I participated in the first forum, and we have the next one coming up. And I read through a lot of the feedback, and over again, what we've heard is that Businesses don't often take these pledges because they don't know that they play a role, and then they don't know what they have to do. So by sort of creating this community, it's enabling them to actually make a commitment to this work. And then lastly, we focus on accelerating the movement, and we do that through an online resource center and a champions network, where we're really fostering an opportunity for dialogue across members from all the areas that we visited and even places that we haven't attended, where we provide resources, toolkits, an open communication platform. And that is, at this point, about it. There's also a research component, which I'm happy to share more about, but I am seeing that I am over time. So thank you.